Hello everyone, I'm Dr. Ann Gillies. I want to speak today on the issue of conversion therapy, and I want to say that I have an undergrad and Master of Arts in Professional Counseling, as well as a Ph.D. in Philosophy of Professional Counseling with certificates in emotionally focused therapy and adult attachment. I practiced clinically for 25 years and saw mostly those clients who had suffered complex traumatic stress disorder. I want to say that the proposed conversion therapy bans, are based on false and unproven assumptions. What are these? First of all, that same-sex orientation change efforts are harmful and that sexual orientation is immutable and unchangeable. I want to also tell you that any kind of psychological treatment can have unwanted outcomes. Every therapist knows this. There's always the potential for perceived harm, for complete failure, and for relapse. Over the course of a lifespan, it's now been found that sexuality is fluid, and this is particularly true in the LGBT community, where there is very little stability in same-sex attraction. For over 90% of Canadians who are heterosexual, there is a different story. Their sexual attractions are stable. Conversion therapy bans target a small community, those with unwanted same-sex attraction. In 2002, a pair of researchers called Schildo and Schroeder decided to study change therapies, and they entitled their paper "Homophobic Therapies Documenting the Damage." They changed their title after the first 20 interviews to changing sexual orientation. And why did they do that? Because the participants talked about finding great relief in talking about unwanted same-sex attraction. They had increased hope and new insight. They had more effective coping strategies, as well as greater self-esteem, a new sense of belonging, and improved relationships. These are all good things. A subsequent study later found that very significant positive changes in psychological well-being among those who had change efforts. In fact, 100% rise in self-esteem. This casts very serious doubt on the claims that sexual orientation change therapy creates harm. Dr. Lisa Diamond, herself a lesbian and a predominant researcher in the area of fluidity, as she says that it is not scientifically accurate to describe sexual or same-sex orientations as an immutable trait or unchangeable. She also states that sexual orientations are not biologically based, like eye and skin color, but they actually are awareness mediated. What does that mean? It takes a mental state. You have to think about these things. You have to have certain beliefs and desires. Also, this creates a dilemma because science supports sexual fluidity and flexibility. But we see a bias here. It's only in one direction. So therapists now are being banned from helping someone who has unwanted same-sex attraction to actually resolve some issues toward a more heterosexual attraction and behavior. But we can help someone become homosexual. There are also very high rates of mental illness within the LGBT community. And it's said that PTSD comes with the territory of being LGBTQ. And of course, it's been attributed to homophobia. But I want to suggest something far different as a trauma therapist. The symptoms that are declared to be a result of therapy change efforts are the exact same symptoms that are caused by trauma. So, complex traumatic stress disorder, childhood sexual abuse, childhood trauma, grief, loss of parent, death, witnessing death, those kind of things create damages in self-esteem, self-concept. It destroys relationships and gives an inability to trust others. So the very symptoms that are being identified as being created by same-sex change efforts are the same as are identified as trauma symptoms. So we need to look far deeper into this issue. We need to identify the outcomes, and we need to spend more time before we make any decision on banning therapies that can actually help someone resolve issues of unwanted same-sex attraction and resolve issues of trauma in their lives. Thank you very much for listening.